Hey guys, it's Maria here from Edge Integrative Wellness. I want to talk to you today about heavy metal testing and now how to heavy metal test. First of all, you might ask, why would I even want to look at heavy metals? Okay, there's lots of things that heavy metals can actually do to disrupt our bodies. And if anyone is suffering from thyroid disease, I always look at lead and mercury. If someone has gout or vitiligo, notoriously always lead. Gut disturbances, actually heavy metals can change the flora within our gut and cause things like small intestinal bowel overgrowth. If someone's having a lot of joint pain or even has mental disturbances, many kids with behavioral issues actually have high aluminum levels. So it's really important that we look at heavy metals as part of the reasons why we may be having different diagnoses, even things like osteoporosis. Many people that have osteoporosis actually have high lead levels because it will actually push calcium down and now allow calcium to help us create a good healthy structure for our bone matrix. So heavy metals could be important to you. And heavy metal testing is super easy. I use 3 different companies. I will use Doctor's Data, I'll use Great Plains, and I'll also use Vibrant America. So each of these tests are pretty much the same. And it requires a 24-hour urine, but I'm also going to tell you how to do, if you're like, I don't have 24 hours to pee in a bottle, I will give you guys a kind of modified version. We want to have at least 6 to 8 hours of urine, so I'll talk to you what that would entail. So depending on how sick someone is, I will determine if we should use some type of chelating agent. So a chelator actually tells heavy metals to come out of the tissue and be excreted into the urine. Another question you might have right now is, why would you use urine versus hair versus stool or blood? So blood actually will only show your very acute exposure. So exposures in the last 72 hours. Over that, you won't see it in the blood. Hair, we get exposed to things topically all the time. So everything from our shampoos to planes flying overhead and gases and other things that are in the environment. Hair can actually tell us a lot about acute exposure in the last 3 months. So let's just say you thought you had taken a lot of things out of your environment, but you're still having exposures. In the last 3 months, it'll kind of give us that of what your acute exposure is there. But urine will tell us what is your bioaccumulation over a lifetime. So lead notoriously we'll see in the bone. 60% of what's metabolized into the body actually metabolizes into the bone. This was seen a lot with those people who lived in Flint, Michigan, when they had the lead pipes and that was discovered. They looked at cadavers later and they saw how much lead had actually seeded in the bone. And they basically came up with the factor of it was about 60% absorption was into the bone. So I will use a chelator, DMSA, and I will give you 2 to 3 of them, depending on level of illness or timing. And these are retaken every 4 hours. So on a typical 24-hour schedule, if we're going to do a 24-hour urine, I'll have you wake in the morning, you'll have your first morning pee, and then after that, you're going to take 1 capsule. And every 4 hours, you're going to take 1 more capsule until all 3 of these are gone. Then for the fun part, you're going to collect all of your urine in this beautiful little orange canister. After you pee, you're going to keep this in the fridge between each urination. This is a single use only and personal use only as well. So keep that in the fridge. You're going to collect your urine throughout the day. The next morning, you're going to shake this up. You're going to pour into a small vial, about 50 mils, and then that urine is going to be shipped off. Some companies like Great Plains will have you freeze it, but with Vibrant as well as Doctor's Data, you do not have to freeze this urine. It goes directly to them in a prepaid bag, and then we get your results back in 1 to 2 weeks. On a modified schedule, what I will have you do is I will have you take the DMSA right at about 5 o'clock. So like when you're making dinner, and then right before bed. So 4 hours later, let's just say around 9 o'clock, and you're going to collect the urine from the time you take the first capsule. if before bed, if you get up in the night to pee, your first morning urine, and then after that, you can ship that urine. That's on a very modified schedule. I prefer 24 hours, but if we're working on a time crunch, we can always use that style. We will get a report back and it will look like this. And this is mine. So you can see I'm not perfect. Nope. And this last 3 years, I've had a lot of, this is barium right here. I actually had 5 different scans where I had to consume barium, and they actually say that barium only stays in your body for 1 to 3 days. But this is 4 years later, and we can see that the barium is not out of my body. So this is why these are important. This is a bioaccumulation over a lifetime, and this may be an answer to a lot of the symptoms that you may be having, whether it be sleep disturbance or brain fog or thyroid disturbance or gut issues. So I really think it's important that we all take a look at what our bioaccumulation is and how do we best rid our body, empty our toxic bucket, and learn how to lessen our load every single day. We're never going to stay away from all this stuff. We're always going to be putting it back in, but we need to learn how to keep this down in our body, how to keep our body at bay and feeling the most optimal. So I will tell you guys, I am doing a 90-day detox challenge. We start on May 9th. And if you sign up, you will either get a free metal or a chemical test. Chemical testing is super easy as well. It's literally first morning urine. You don't have to do chelators. You have to do anything like that. You pee once in the morning, you put it in a bottle, and you send it off in the mail. As easy as that. We'll be able to see the chemicals that you're being exposed to, what's really high, what we need to work on. So things like dry cleaning, or if you live on a golf course, you may have organophosphates and different things like that. So I implore you to come join us, come see what's going on in your body, see what you've accumulated over a lifetime. How do we best optimize you, and how do we keep you going throughout this very, very toxic world that we live in? It's never going to be perfect. It's not going to get better. It's only getting worse, but there are tips, tricks, and modalities to be able to lessen our load. And I'm just so excited to start this, and I'm excited to work on myself and share that with you, and we can share these experiences together.